Okay, so for this week's podcast, we're going to have a deep dive into Botox. As a beauty journalist, I feel like it's been around forever, but I am old enough to remember life before and life after Botox. Some people probably don't remember any life before, but there was. I guess a good way to introduce it is to give it a little bit of context, if for anyone that doesn't know, because Botox didn't start in the beauty industry, it started with medicine. And in many ways, that still shapes how it's used today, if people are aware of that or not. It was originally derived from botulinum toxin, which is one of the most potent neurotoxins known. And it was first used medically, as I've explained, not cosmetically. Its early uses were actually used to treat eye muscle disorders and also neurological conditions of people that were suffering from spasms. So it was used very effectively for a long time. Cosmetic use, is this actually true, Ravi? Was it discovered accidentally? Medical use.
Yes. There was an ophthalmologist called Jean Carruthers and her husband, Alistair Carruthers from Canada. And they were studying the use of it around the eyes for tics, spasms, and strabismus, so like squints. And when they were using it on patients who were coming for the spasms, the eye tics, she noticed that her patients were loving the treatment because it was making their smile lines, their crow's feet lessen.
Yeah.
And so that sort of a light bulb moment. And she decided, how would that work on the frown lines in the middle? Because that's a big concern for a lot of people aesthetically. So she did a first injection pattern on her receptionist. And then the rest is history, really. It's just the whole concept stemmed from there. If we go back a little bit, botulinum toxin was first discovered in the late 1700s. And it was discovered because people were dying from food poisoning from spoiled sausages back in West Germany. And they were having these dinner parties where blood sausages would be served. And they were contaminated and people would die from these. And there was a big outbreak of poisoning. So this German doctor identified that there was a poison from sausages, so he called it sausage poison. And that's where botulism comes from.
And I shouldn't be laughing. People died, so I shouldn't be laughing.
People died, but he actually spent the next 10, 12 years investigating what it was about these sausages, what was this poison and how it did impact the body. And he actually experimented on himself by injecting parts of himself with this bird, and he identified temporary paralysis, temporary breathing disorders. And then it took about another 150 years to really isolate this and identify what this bacteria was and what the poison was. And it wasn't until the mid-1900s, so just around the World War II area, where it was first isolated and reproduced on a mass basis, and then investigated for, could this be used medicinally for certain muscle spasms?
So who knew? Some people dying from some food poisoning from some sausages in Germany would lead to something that then became so huge. So it was FDA approved for cosmetic use in the early 2000s. I remember it really well. Until then, as a beauty journalist, all I was really writing about was a few creams on the market that apparently were going to make you look a little bit younger. And then suddenly, boom, everything changed. And it was very dramatic, wasn't it? What was that like for you when suddenly it was available and the demand was off the chart?
Yes, I started this about 20 years ago, and some people knew about it, some people didn't. Certainly in London, it was very well known, but outside of London, it wasn't really a known concept. And back in those days, people were just grateful to have any reduction in their frown. There was no consideration of balance. There was no consideration of, does that expression fit your face or lack of expression fit your face? It's all about, I don't want to move, full stop. Yeah. And that's where the concept of frozen faces came around, and the ab fab faces where they're just completely frozen, can't move. And that's because at the end of the day, there was very little understanding or education or instruction.
Okay, so let's go back to basic. Let's talk about what it is, and then we're going to talk about what it isn't.
So botulinum toxin is a protein that's secreted by a bacteria called Clostridium botulinum. And what it does, it temporarily prevents the signal from the nerve going to the muscle. So if you want to subconsciously contract a muscle, your brain sends a signal down a nerve to the muscle, and then the muscle squeezes, contracts. What botulinum toxin does, it prevents that signal reaching the muscle. Okay, that's what it does. And then so the muscle therefore can't frown or contract as well as it usually does. So you get a softer expression, or in some people, an absence of expression. And then over the next 2 or 3 months, your nerve endings tend to sprout new nerve endings to heal, to recover, because it's in the body's natural response to recover and try to optimize its function.
I didn't know that. Okay. And then I guess what it isn't, because there are still lots of misconceptions around it. What isn't it going to do?
Well, botulinum toxin type A is not toxic to the human body at the prescribed doses. Obviously, the molecule, if given in about 1,000 times the dose, can kill. Okay, because what happens is you get botulinum toxin into muscles which you desperately need to function and survive, such as your breathing muscles, your respiratory muscles, or your heart, which is a big muscle. And if those are riddled with botulinum toxin, you will not be able, the heart won't pump and the chest won't be able to expand and contract. But it is a very locally acting drug. It has a radius of about 1 centimeter. So when it's injected in medicinal doses, and it will literally just stay where it's been injected. And recent findings have shown that it binds within literally 4 or 5 minutes and is fixed within about 12 to 15 minutes. So, yeah.
How long it how long it lasts? That's the right word. It varies from patient to patient.
It does vary, but there's a window where maybe 95% of people would fit into. Traditionally, toxins would take about 5 to 10 days to take full effect, and that's in about 95% of people. And then it would return to normal, so you return to pre-Botox treatment phase, so we call that baseline. That would be in about 3 or 4 months, depending on which toxin you have. Some of the newer toxins would say they get to about 5 to 6 months. So but there's always variations. There's an outlier, for example, you may only get 2 months duration out of it, and there's another one that might get 9 months duration out of it. Yeah. But I would say about 95% of people should expect to get about between 3 and 4 months longevity.
Okay, now I guess what's really important for patients to understand is what it can do and what it can't do. So let's do the cans first. What would you, if you wanted to be treated, what could it do for you?
That's a very open-ended question. There's physical effects and there's psychological and well-being effects. Okay, so if we let's start with the psychological impact first, all right? Because that's little talked about. Everyone talks about lack of mobility first, but absolutely the reason people have this treatment and why they repeat their treatments is not because of the fact that their muscles can't move, is because the effects make them feel better about themselves. It improves their psychological well-being. And it's not just a physical reduction in lines and wrinkles or lift or smoothening of areas of the face that does that. There are several studies now that have shown that there is actually a positive impact on the mood centers of the brain. And that is why people feel better with Botox type treatments.
That's really interesting. Yeah.
There have been some studies which are suggesting that it can be improved with improving moderate to severe depression patients. And that works on the negative impact, the negative feedback loop of certain expressions. So, for example, look, I'm going to give you a negative expression now because my Botox has run out, but this expression here, that is a negative mood. No one does that when they're happy. Okay? Now that will send negative feedback to the mood centers, and it can, if you do that repeatedly, can make you feel low or in a less happy mood. If you reduce that ability for your body to reduce that negative expression, your mood will naturally lift. So that's the biggest reason why I believe people carry on with this, because it's a feel-good factor. Now, in terms of your appearance, what can it do? You've got to understand what it does. It relaxes muscle. Now, sometimes if you relax the wrong muscle, you get a drop, okay? And sometimes, and what we have to understand is our muscles in our face generally are working in opposition to each other. You've usually got pairs of muscles which pull the brow down, for example, and muscles that pull the brow up, lift the brow up. And what we try to do is create a balance. So if we take out this muscle here, if I reduce that expression there, what I'll find is that my brow will naturally lift. But look what happens here. My horizontal lines in my forehead have become unopposed. There's nothing opposing them. So therefore they become a bit more obvious, a bit more active. So that what I get there is a higher up brow and maybe a more awake look, but then I've got more wrinkles than I did have perhaps at rest in my forehead. Now, that can be balanced, and we can soften that. But when people are over frozen on their forehead, you find that their brows will drop because we need that lifting ability. So it's all about balancing aesthetic appearance, functionality, as well as mood. Now, as we age, the strength of those muscles varies, and we find that the depressing muscles get stronger, and as a result, the lifting muscles have to get stronger, because otherwise we won't be able to see. The brows will drop too much.
Yeah.
So that's why sometimes people's Botox pattern changes. Usually at about 45 onwards, things change and they go, oh, it always used to do everything for me. Why doesn't it do it now? That's because your skin's changed, your elasticity's changed, your laxity's changed, your collagen content's changed, the fat pattern underneath the Botox have changed, your skull has changed, muscles have thinned. There's so much to consider, and Botox just does one part of your aesthetic management.
And what can't it do?
It can't fill your face. It can't correct volume. It can't do everything. Okay, so often people will say they're so impressed by what Botox will do, for example, on the middle of your eyebrows, the frown lines, and around your crow's feet and in the forehead. And then they feel, oh, can it fill my lips, please? Can it just restore my lip volume? Can it get rid of my nose to mouth lines? Can it get rid of my teardrops? No, those are tissue-related conditions. They need maybe a dermal filler, such as a hyaluronic acid or a collagen stimulation, so they won't be corrected with multiple, what we call neuromodulators, botulinum toxin, that affect how the nerve impacts the muscle. It's also useful on the lower face. Okay, so just as much as on the upper face where we're treating opposing muscles, a lot of people don't realize that one of the reasons we have jowls or the blurring of the jawline is because our neck muscles actually, as we get older, strengthen their pull on the mid and lower face. So they're pulling your face down.
I just assumed it was just gravity taking hold on the face, but it actually
muscular. Yeah. So what we can do is relax the strength of that downward pulling muscle, which is called the platysma. Inject along the jawline and along the bands of the neck, and you'll find that the jawline will be lifted and tighter because the excessive downward pressure has been reduced with botulinum toxin. So again, what can it do aesthetically? Pretty much, it can also reduce functional excessive grinding on the masseter muscles, bruxism. It can work in migraines because it had an impact on the vascular component of migraines as well as the muscular tension. It can work for excessive sweating, particularly in the armpits. And there are a whole host of medicinal uses as well. Bladder irritability, certain bowel spasms, spasticity, horse eyes. Medicine's really looking into what can Botox do for many indications, not just aesthetics.
Okay, so from what you're telling me, I think that the conclusion really is not about freezing your face. it's about editing movement. And I guess the effectiveness of that is very much going to be down to the person who's administering it and understanding how your face moves and what needs to be done, because obviously it's very personal to everyone. Because I think it's probably fair to say that you only really notice people who've had some bad Botox, because obviously I write about beauty. I do notice these things. But the people who are having really good Botox, you don't notice it, because actually all it's doing is balancing out your face and making you look fresher.
That's exactly it. Exactly it. People who, if you can see someone who's had Botox, and it's usually on TV, or they, like you just said, they haven't had the most optimized Botox. But there's also this younger group of people who will come in wanting this fan style of Botox, I would say, this social media style of Botox, which is, it's almost like a status symbol. They want to show it off, and they want to show that they've had it, and they want to look like these mannequins. My patients,
I think my generation absolutely do not want it to be noticeable, and it's all about looking natural and just looking better. But actually now you've got a whole new wave of people coming through who do want it to, as you say, almost, it's like a badge of honor.
like exactly that badge of honor again, which we were talking about on another pod. I'm going to give you the true story here that happened to me in clinic about maybe 6 weeks ago. Phone went, and someone's asking about something called trap tox. Do we do trap tox? And I haven't read it but when I asked them, I says, oh, she said it was the tops into the trapezius. So this is a muscle along your shoulder to reduce the size of the shoulder so you don't look too masculine, and it's great for women. Now,
Wow. Don't even
and I have done that for muscle pains and trigger points. Okay. And I said, oh, yes, we do that. And she goes, oh, can you teach me? And I got this literally over the phone. Someone said, can you teach me how to do Botox? And I literally was blown away. I was actually caught off guard there. I did not expect that. The person said, I am an advanced aesthetic practitioner, and I understand anatomy. So can you teach me? And I said, how long have you been injecting for? And how long have you been? Tell me about the course you've done and what's your background. Their background was literally nothing to do with clinical medicine or nursing or dentistry or surgery or dermatology. They'd been on a one-day course, which they'd seen on social media. And they wanted to be told over the phone how to do it.
Wow. You know? The implications of someone ejecting into your neck or anywhere in that area that is not skilled, that's terrifying.
If there's anyone listening to this pod who has considered going to a non-medical, someone who has, there are several safety concerns you need to understand. First of all, that person doesn't have a clear understanding of anatomy. It's impossible for them to do that in less than 5 to 10 years, let alone 1 or 2 days. Okay? And two, who's prescribing that Botox for them? Where are they getting it from? Because it's a prescription-only drug. This can only be issued by a prescriber.
How are they getting it then?
They're getting it from unscrupulous prescribers.
More term like that. A, they don't know what they're doing, and B, they don't really know what they're using.
And the biggest guilty party here isn't the student, the ignorant student here, because it's the trainer who's telling them they go on their course, they'll be good enough to do this. And so you can't blame them. They don't know anything different. They literally are ignorant. But they said, I want to do Botox. How do I do Botox? Oh, look, there's a course. It says I'll be certified. It says I'll be an advanced practitioner.
Wow.
And that's the issue, is the trainer. So that's where we have to watch out.
Yeah. Which goes back to the podcast that we did on really doing the research and finding out that it's so important that you ask the right questions and you know everything about the person that you're going to see.
Yeah.
Okay, so I think that's pretty clear. I think to sum it up, because this still amazes me as a beauty journalist, I still get asked these questions, bearing in mind that Botox has been around for so long. They're just really common myths, and I think we just need to throw them out really. The idea that you'll look frozen, I think we've addressed that. If you go to someone that knows what they're doing, you will not look frozen at all. That is not the aim. As long as you've done your research and you go to someone who knows what they're doing, you're not going to end up looking frozen. This is a good one that I get a lot. Once you start, you can't stop. Oh no, I'm not going to have Botox because if I have it once, I've got to have it for the rest of my life. What would you say to anyone who asked you that?
Of course you can. Of course you can stop. And I think the big concern is, would you look worse if you stop? Okay. And you will look 100% better if you stop Botox compared to if you've never used it in the first place. Okay, and so I just want people to understand that. If you, let's say you start when you're 40 and then you stop when you're 50, okay, you would have bought yourself 10 years of rejuvenation and fewer wrinkles, okay? And therefore your skin will be smoother, will be less ingrained in grooves, and your muscles will be strong enough to maintain the natural expression so long as you have not been permanently frozen for that period of time.
Okay.
Because
And what do you mean by that?
If you've had zero movement for even 6 months or so, like no movement at all, your muscles will thin, okay? And they will weaken. Just think of people who maybe they've been in a leg plaster cast and they can't move their leg. Their thigh is naturally thinner after just 6 weeks. The same with all muscles, okay? So that's why it's absolutely imperative that you do have some movement to reduce the risk of muscle atrophy or thinning of the muscles. So yes, you can stop Botox when you want. You will then frown naturally again, okay? Maybe a little bit less because your habit will have been reduced in intensity.
Yeah.
And you can pick it up when you want. Yeah, yes, of course you can stop. You're not addicted to it. You just enjoy benefits.
Yeah. And then it's only for older people. That's what I get.
So
When you're old, but actually, you just explained that very nicely. That's actually the wrong way to approach it because you could have been reaping the benefits if you'd started sooner.
Yeah, it all depends on how older people are. When I was a 20-year-old, I am an older person now at my age. So I think there is an element of how young is too young to start Botox, okay? And I would say that for aesthetic or rejuvenation reasons, if you're in your 20s, say, and you've got excessive frowning, just genetically, that's what you've inherited, that's what you've learned from how to move your face from your parents. The first thing you should be doing is making sure you've got optimized skincare, and that the main topical ingredients that dermatologists pretty much insist on everyone is a good retinoid of some sort and a good sunscreen.
Yeah.
Those are going to regenerate your skin and protect your skin. Okay. If after that, and you tried non-pharmaceutical ways of improving your appearance and reducing the appearance of lines on your face, and you're in your 20s and you're older than you really should be, go and see a good practitioner. They might suggest some Botox, and then it might well help keep your skin looking smoother and younger for a longer period of time.
Okay, that's brilliant. I actually thought I knew everything there was to know, but I learned something there. So I think to conclude, it's not a miracle, but it also isn't the enemy. It's a tool, and like any tool, it depends on how, why, and by whom it's used. Is that fair?
Yeah, absolutely. But it's not, once you have Botox, you can't go back. That's still but no people don't want to.
Okay, thank you. What are we going to talk about next week?
I've just come back from a World Congress in Monte Carlo, and there's a shift in focus now in aesthetics. We're moving away from the face, and we're looking at areas that can be treated with injectables and non-surgical methods. And we're looking at how to improve the quality of the neck, the décolleté, the upper arms. You had a term about all of that?
Sleevage. That ties in very nicely with my week because I've been focusing on, obviously from the sort of more creams and things you can do, on the sleevage. The new cleavage, Ravi, is all about toning your upper arms and the décolleté area. So that's perfect. Let's talk
sleevage
about
and cleavage. That's the title for next time.
Okay, next week. Tune in.
Tune in. See you then, guys.
Bye.